Now, the following lecture, it's going to be with Manuel Fernández. He's going to talk about the development disorders, which is very important, and this illness and this syndrome generates many doubts, many nights without sleep for the father. So thank you so much.
The first thing I want to do is congratulate all of the participants in this event, because I think the information we're getting is, I don't know if you're aware, but it is of absolutely incalculable value. I can't believe that we're hearing such important, such valuable things. Sometimes we don't realize that we have so much know-how in our country. I'd also like to thank the organization, Ricardo in this case, for inviting me, because really it did actually come up by chance. I didn't know that I had a Schaaf patient in my office, and the family reached out and told me, hey, we'd be seeing each other here. So it's a small, small world, but things happen. I'm going to talk about something that's perhaps broader than what we've been hearing so far, a bit more general, and it's to do with the perspective that we have regarding how, the why, and the what of these development disorders. And what I want to do, what I want to achieve with this session is to give everyone a comprehensive, homogeneous neurobiological insight of what we're dealing with. I like to wear this type of microphone because I love moving around. I know I make life difficult, but I'm going to try not to make you too dizzy, especially the cameraman. Before I begin, I'd like to give you a bit of an idea of what I'll be talking about. And it's what I call the paths of truth, the path that anyone with a development disorder follows, as compared to what society and our surroundings, and particularly the educational healthcare system, actually allow them to do, with the paths they allow them to take. As we know, someone with any form of neurodevelopmental disorder has a very complex, very windy, twisty path with a lot of sharp turns and complex situations, and yet we have a healthcare system and an educational system that sadly have very straight lines, and the educational system is very much established. It can be better, it can be worse, but at least we know what we're dealing with. And it's very limited in time and in the variability that it allows us to follow. However much we claim to be dealing with diversity and inclusion, I think that all of this has great room for improvement. And you've all mentioned the difficulties that the families face when dealing with loneliness and adversities, knocking on doors, asking for help in a healthcare system which regrettably is ready for a series of steps and managements, but not others. And ultimately, the families, you're here because you are the ones who guide these patients, these children, through their lives as best you can, trying to adapt to their needs. So this wobbly line here is like the really wobbly one at the top, but a little more compressed. So what we would all like to do as professionals is to make these lines disappear so that we can really provide the right kind of guidance for anyone with a neurodevelopmental disorder.
La información que os voy a dar es bastante...
As I was saying, the information I'm going to be sharing you is much broader, more generic than what we've been talking about so far. And my main goal is to share with you, with each and every one of you, the importance of having a homogeneous vision, an outlook of what neurodevelopmental disorders look like. These are the neurobiological foundations to help you truly understand what we're talking about when we talk about all of these topics, because we're talking just about one syndrome here, one disorder, but this can be perfectly applicable to any other situation in other disorders, in other pathologies. And if I'm able to do that, then I will be happy with what I've done. I don't have any ulterior motives or any expectations, but although we've talked a lot about mirror neurons and back in the day, it would be really nice if we could also give you an overall vision of how they apply to each neurodevelopmental disorder. because ultimately everyone who is involved in dealing with people with a neurodevelopment disorder aims to develop their process as much as possible and to empower their DNA, their genes in every way we can, to help them develop as fully as possible. Now, I'm going to raise a question. Usually I raise it to a bigger room, but are you okay with this? Do you want to have a conversation rather than just listening to me speaking? Tell me. Are you happy to hear this from me, yeah? Okay, loud and clear. Another question. How many of you here are patients of families? Pretty much everyone, okay. Healthcare professionals? Just healthcare professionals? Okay. And how about people from other areas? Because we're often talking about healthcare. Well, welcome to you as well. I'm going to share with you 4 steps that I think are important. We've talked about the neurodevelopmental process, and I'm just going to give you I'm going to briefly defend the role of neuropediatricians in the diagnosis of neurodevelopmental disorders. Earlier I was speaking to, I think, Ricardo or maybe Manuel, and I was saying that when I started working here, and I started in 2009, I'm now 44, people didn't even know what a neuropediatrician was. They would just go to the logopediatrician or a psychologist if they had behavioral disorders, but early care from a neuropediatrician was unheard of. So then I'm going to give you a brief outline of the strategy, the 4 steps that we follow to deal with a development disorder. I think everything that's already been mentioned previously about genetics is super interesting because we often come across some really crazy things, and we're going to be looking at that later. But having a patient with Schaaf-Yang syndrome may seem like a coincidence, but actually, most of the patients we see with neurodevelopmental disorders are not studied because we don't go any further than the basic tests, and they basically say to the families, I'm sorry, that's it. There's no more genetic studies to conduct. But this is 2024. How can it be that it seems like exomes don't exist, genome studies don't exist? And then I'm going to leverage all of the information that I've given you to share with you an outline of the perspective from genes to behavior going all the way through life, which I think already the previous peers have mentioned. And then I'm going to talk to you about what I call self-introduction or the outroduction, which is my afterthoughts, my conclusions, and my farewell. That's the menu. I hope it's easy to digest for you, and I hope that when you've finished eating, your ideas are clearer in your head. So let's get into what I was talking about at the beginning.
El neurodesarrollo. Hemos hablado aquí de
Neurodevelopment. So we've talked about neurodevelopment, about disorders, but what does neurodevelopment mean? Neurodevelopment, and okay, I was telling you this is going to be broad, generic. Neurodevelopment is every evolutionary process in the creation and maturation of each and every structure in the nervous system. And there are 4 important points to be taken into account here. There are stages, which in summary we could say are creation and differentiation. And they actually overlap a little bit. There are also, and there's another important aspect, which are the characteristics of that neurodevelopmental process. Each area in the nervous system has a series of specificities, peculiarities, functions. And then it's also important to consider the duration. The neurodevelopment process begins after the 3rd week of pregnancy, and studies that assess executive functions, maturation processes, tell us that we are developing beyond 18 years of age. So it's so important for neuropediatricians to actually see patients beyond the age of 18 as long as there is a neurodevelopment disorder. And it's also important for us to take into account all of these processes. It's also then important to talk about comparison. Okay, comparisons are not always ideal, but in this case, comparison is crucial in detecting anomalies or difficulties. So it's really essential to have these comparisons to understand alterations. All of this has to do with the influence of genetics and the environment. We've got the pre-gestational stage, which is not very studied here in Spain, but there are places where they have dedicated pediatric pre-gestation units. There is the gestational period. There's the one that affects infancy and adolescence, and then there is the period that affects adult age. We're talking about the central nervous system, the brain, the cerebellum, the spine, and then there's the peripheral nervous system, and there are some disorders that can also be encompassed under this umbrella. The type of activity involved in neurodevelopment is not just diagnosis and treatment, it's promoting good health and preventing alterations in health. And then there are also the types of pathologies. I sometimes do get into a bit of an issue when I talk about the physical and mental symptoms as compared to pediatric neurology, psychology, psychotherapy. But I think we often see cases, very similar medical cases. What changes is the clinical expression. There might be more physical symptoms, there might be more, let's say, behavioral symptoms, but they all overlap. And I know that not just in Andalusia, but also in Andalusia, it is mental health that deals with neurodevelopmental disorders. Don't ask me why, that's just the way it is. There's another interesting thing for me to note, which is not specific to this syndrome, which is that the first stage in mental health is clinical psychology. And when we have a series of social difficulties, it might be difficult for the psychologist to see the patients because, according to the ethical code of the College of Psychologists, both parents have to agree if the child has to go to a psychologist. So that is already a spanner in the works. I know I've been talking about some, let's say, controversial or politically incorrect topics, but I think it's really important to lay everything on the table. When we're talking about neurodevelopment, neuropediatricians are in charge of caring for the central nervous system right from the moment it begins to be created all the way through to its full development. And it follows these 4 criteria. It has a specific period, there are the parts of the nervous system, there's a type of activity involved, and a type of pathology. And so the neuropediatrician's job has not yet been acknowledged as a specialization. If you're a neuropediatrician here in country, it's because you were a pediatrician and you personally took an interest in specializing in this. If we don't have a specific specialization, we're going to struggle. We won't be able to guarantee that we're able to care for people who are affected by this. They are specialists in the nervous system right from its very early development all the way through to beyond the age of 18 years to ensure diagnosis, treatment, promotion, prevention of any issues that may occur in the nervous system, central or peripheral, regardless of the type of symptoms that we're dealing with. This is step 2 in my 4-step process. We're going to talk about the 4-step strategy that we follow to deal with development disorders. I always draw this for people. The straight line would be the normal neurodevelopment process of a normal child, 3rd week of pregnancy all the way through to adult age. But what can happen? Well, they can diverge, go off the path, they can go more slowly. These are the kind of alterations that we can encounter throughout the neurodevelopment process. And so I always say to families is that the first thing is to compare. When you assess someone who appears to have a neurodevelopment disorder, you have to see whether things are happening normally or if anything has been altered. Are they hitting their age-appropriate milestones? Are they doing anything that they should be? Are they not doing anything that they should be? So this line is what we need to compare with to see whether they're getting to the right point or not. So comparison is crucial. And during that first step, we then talk to the parents, the schools, the surroundings, the pediatrician. But it's clear that the first thing you have to do is detect this lack of normal development. And I like to insist on this because I don't know if you families have encountered this. A lot of people come to my office and I knew something was wrong with my kid right from the age of whatever, right from such and so month. My kid wasn't talking, my kid wasn't walking, he didn't start to, crawl, didn't start to stand, he wasn't progressing as expected. And everyone would say, give him time, just wait. Some are faster, some are slower, everyone has their own pace. Okay, yes, but it's always within a certain spectrum, right? And one of the first things they showed me in the hospital when I started in the ENR unit was... I'm sorry, the interpreter apologizes, the microphone is not working at times.
Unos que llegan con mucho aire. Y después, si A ver, yo sabía que le iba a dar...
You see, I knew I was going to make life difficult for someone. It's all about the light. I have to stand in the light. So, if a mother comes in and says there's something wrong with their child, believe it. Just believe it. And do not rest easy until you're able to prove that there's nothing wrong with them. Because, okay, there are crazy people out there, but if a mother or a father says something is wrong with their child, they're usually right. So saying to them, nah, don't worry, it's fine, then that's not helpful. It does happen. So we can see the process. We know that it's altered. What alterations can we see? Well, there might be a straight line, but slower than it should be. Not usually presenting more than a 25% delay in the motor ability skills and so on. Or the slowdown might be much more significant and severe, or there might be things that are abnormal happening, perhaps because they're more advanced, or perhaps because they're more delayed. It's what we're defining as a delay or a disorder, because they all ultimately cause a delay, but there's always something along these paths. When there's a disorder, there's always an upset somewhere. But it might not just be a simple delay, which means that they are slower to walk, slower to speak. But they might not present any genetic difficulties or disorders. However, when it's a really clear difference because it's either super slow or because there are anomalies in development, that's when we have to think that there might be a disorder. Some of you, if you're healthcare professionals, might think this is really basic, but it's not always seen in these simple terms. Once we know that there's a disorder, we have to wonder what characteristics this disorder is presenting. There are some really clear disorders, very specific, that we can apply a surname to, that we can give a name, but others are less so, and they might be neurodevelopmental disorders that are called unspecific. It's not the same as a TGB, but this is what I like to call them. And the fourth step, we're going to look at this all more slowly now, is when you talk about differentiation between a primary or a secondary neurodevelopmental disorder. This is what we've been talking about in all of the previous sessions.
¿Qué cosas tienen que estar pendientes?
What do parents have to be looking out for during the neurodevelopment of their kids to see whether there's something that's not fitting in? And what are the universal concerns of parents? Well, they have to focus on learning, academic performance and work performance, behavior, social, family and personal relations, then the process of maturity and development, and another very important aspect which we forget are feelings, emotions, self-esteem, self-conception, and emotional stability. If we focus on these 5 areas and we see that things are going okay, great, but if they're not, if anything looks like it's not quite normal, then we need to understand, we need to really focus on the difference. So we have the concerns, and then we have, let's say, the solutions that we have to be looking out for. We have the idea of normal delays versus disorders. And here, let's go in to talk about the disorders themselves. They're cousins within the same family. Okay, all these disorders belong to a big group of pathologies with very diverse causes, symptoms, repercussions, and often diverse treatments. However, they can overlap. They all involve changes in this process, in this neurodevelopmental pathway. Sometimes they coincide, they converge, others they don't. But along this path, there is no black or white. There's always shades of grey. Genes, and this is important, are ultimately responsible for the symptoms, always also in relation to the environmental influence.
Qué silencio. Esto lo quiero dejar ahí claro, ¿vale?
I want this to be clear. There have 8 disorders within the same family. We're going to talk about overlaps, shared symptoms, and this slide, I've got 2 copies of this slide with different pictures, and I'm going to show you both of them. There's the symptoms that someone might have and their classification, because even though the people at the DSM are the authority, they've got the final word, I don't always agree with the 8 classifications. We've got ADHD, hyperactivity, impulsivity, attention deficit. They're often diagnosed as attention deficit disorder. Autism spectrum disorder is often, it's a really easy diagnosis. People tend to diagnose them as having autism spectrum when they have issues in communication, relation, behavior. There are difficulties reading, writing, calculating. There's eating disorders such as anorexia, bulimia, and there are tics, movements, Tourette's, stereotypia, which is not just, they might not be autistic, they might be. So we have to just change the way we see all of this anyway. There's also OCD, obsessive-compulsive disorder, which is to do with obsessions and compulsions. There's language issues. I only write language, but I also like to specify that it involves communication. It's social communication sometimes. They might not have a language disorder. And then there's alterations in their intelligence quotient, in their IQ, because they're configured, they're wired differently in their neurodevelopment. Here we have this interesting image, because each of these circles represents one of the disorders, and here you can see how they overlap. And even right in the center, they might all overlap in a tiny, tiny way. And ultimately, what does that all depend on? It depends what the name we give to their syndrome. It depends on what circle they're in. And I always like to show this image that the small grey circle is their child, and that big circle is what they might fall, the categories they might fall into. So they may present more or fewer symptoms, so it might be very clear, but if they're kind of on the borderline, they might have traits from some disorders and others, so they might all intersect.
De esa forma, si tenemos un nombre y un apellido muy...
So if we have a very clear disorder with a name and a surname, then it might be a specific one, it may be ADHD. Or if we have a combination or a partial combination, then we have these unspecific neurodevelopment disorders. And we're now going to consider what it would be for them to be primary or secondary neurodevelopment disorders. What's causing the problem? Well, nowadays we have a lot of tools to assess this from a neurobiological point of view. And we have cutting-edge technology, very high-level technology at our fingertips in the public healthcare system, which sometimes for financial reasons, for budgetary reasons, or purely for lack of knowledge and awareness among certain professionals, we are finding obstacles in obtaining information on the characteristics of the symptoms we're dealing with on a day-to-day basis. Out of all the families who are here today, you've got your diagnosis, you've received your tests, but how long do you think, on average, if you don't mind answering, has it taken you to go through the whole diagnosis, the stereotyping, exomes, and all that process? How long do you think it's taken to get all that done?
Pues hoy las guías internacionales...
International guidelines from the American Genetics Association and so on, they say that if there is a neurodevelopment disorder of unknown origin and when there are facial or dysmorphic characteristics, the first thing that has to be done is a right, and then if it's normal, they will have to proceed to an exome. And it can be especially useful if it's three-way. This can be really relevant because often these children's siblings or family members are not tested. Don't ask me why. with a clinical exome, which costs €1,500, if you skip doing that, it takes years to get a diagnosis, and the future of these kids is at stake. I told you I'm going to be politically incorrect. I plan to continue that way. What about the neurobiology of neurodevelopment? What does this mean?
Lo que yo quiero transmitiros con esto es que
what I want to share with you here is that there are 6 levels, 6 layers of neurodevelopment, which I think are important. I'm going to define this better later, but if we talk about tests or assessments within this scale of 6, we could say that in terms of behavioral patterns, which is what you see or what we each see in your children's behaviors, we have different tools. We can do an observational or a conductual or behavioral evaluation. There's an interesting tool. It's not very well known. It's called DIDE. It's an online tool that helps us through a series of questionnaires, validated questionnaires, to do some profiling of the characteristics of the child that we're dealing with, to understand their environment, see whether there's anything out of the norm or what's normal. There's also ADIR to see whether they have autism spectrum disorder. This is the most superficial thing and the easiest thing to see. Then there's neuropsychological patterns, such as evolutionary functions and so on. This involves a neuropsychological evaluation and everything that ensues that. Then there's the brain electric activity. Now, why do I talk about brainwaves? Because I'm going to go to the end now and then work backwards. A person's genetic predisposition is like the blueprint to build a building. And here we're talking about neurodevelopment, so that would then be where the brain structure comes in. That's why it's so important to study everyone genetically. These people, studying them genetically, doing the karyotype, the X fragile and exome, genome, the CGH array. This is done. It's all done. It can be done. But it seems sometimes like we're talking about science fiction. We're only talking about human genomes on TV and the news. But it can be done. So how do we analyze someone's brain structure? Well, with magnetic RMI scans, CAT CT scans, and so on. Today, Dr. Moscatelli shared a very beautiful image of a brain with a lot of different connections, and that was basically an MRI scan and a tractography that allowed us to see the traces of the nerve fibers. Is it used? Well, no, not often, because there isn't a standardized database with which to compare. So there's a lot of things that are still in the pipeline, still developing. And depending on how our brain circuit works, our neurotransmitters, all these synapses that our colleagues, our peers were talking about earlier, there's going to be this specific electric activity in the brain which can be altered or not. Sometimes we don't see the alteration because our technology is limited. So we have these electrograms and cartographies and so on. We often talk about the top of this list, but we rarely go into talking about the bottom. From genes to behavior, touching on life. So why do I say that? Well, this would be the slide without any indications on it. These 2 top lines are what I call the psycho side of things, and here is the neurobiological side of things. We've talked about the blueprints to build the buildings. The circuit would be like all the cabling, the wiring, and then there's the electrical activity, which is when all of those circuits start to work. This is all very pretty, very nice, but our brain is so much more complex. It doesn't have defined borders, geographical limits. Each area is theoretically defined to its own function, but that's really theoretical. The reality is different. Another important topic, as I was saying earlier, I was talking about how we're going from genes to behavior through life, because timing is important, because each neurodevelopment disorder has its own timelines. I'm not going to linger to talk about each one now, but here's the order so that you can see when are more or less the windows of the onset of these disorders. Sometimes they can overlap, sometimes they can happen all at once. Have I got 5 minutes? Okay.
Vale. Esto es lo que decía antes de...
These are the diagnostic assessments we can carry out, but I can also focus on how we can actually approach the therapy, the treatment, because there are different planes, different levels. At each level, we should be able to establish a diagnostic evaluation and a therapeutic intervention or action. In terms of behavioral patterns, we can do academic reinforcement, behavioral therapy, occupational therapy. We can do logopedia, everything to do with the behavioral side. In terms of the psychological side, we can do cognitive therapy. That's why this is so relevant. There's also neurofeedback on brain activity. We can also apply nutritional supplements and pharmacological treatment, drug treatment, to improve the brain circuits. And these treatments can be applied regardless of the origin of the alteration of those circuits. We can also use TDCSs, brain stimulation, or using magnetic fields, and gene therapy, which in some cases is clear, and it is actually proving to have very good results. Since we're short on time, I'm going to just skip some of this and head to the end, which is the most important bit.
Uy, me lo he vuelto a poner ahí. Espera. Hay un aspecto importantísimo que es...
There's a very important aspect, which is to be clear on the fact that a more or less mature child depends on these self-control processes. And when you say that a child is mature or not, it depends on these regulation processes. Our brains, as I was saying, and as Dr. Moscatelli was saying, is constantly under development. And so brain plasticity is crucial. It's very much more intense in the early years, but it's still important to take it into account, because in adolescents and in adults, you can achieve good things, even though, okay, it's better in children. It's all a continuum from 0 to 100. And if you do nothing, the path is just going to be the same. But if you do things, you can achieve changes in the level in each of these altered development processes. There are synaptic functioning mechanisms where the brain circuits are crucial in understanding and how each of the therapies can come in and what they can achieve. And then lastly, I did not want to... Actually, I am going to skip this for a second, and I'll come back to it. This is the synaptic functioning mechanism. The one at the top would be, let's say, balanced, standard, normal functioning, and at the bottom it would be an altered synaptic functioning with neurodevelopment defined by executive deficiencies, as could be the case in ADHD or any other disorder of this kind. In this mechanism alone, where we act in the brain circuits, we can act at different levels. We could put a stop in it, put a blockage in it to block the leak and the presynaptic excess. We could use psychostimulation or not. There are lots of alternatives. We can use food supplements such as omega-3. There are studies that clearly prove that there's been an improvement in brain plasticity processes. There are nootropic substances that can help improve communication because they're postsynaptic. And we can also compensate the difference in performance that can be achieved with external stimulus and how they deal with stress, anxiety, uncertainty, both physically and emotionally. And then lastly, to finish off, these are some of my afterthoughts. We need to work with neurobiological bases in order to tie everything in, all of this diagnosis, and we all need to be speaking the same language, and research needs an objective base. And what better than the examples that our peers have been giving us about what is being done well and what is not, to understand all of these changes and to make all of these lines converge and to better understand everything from the genes to the behavior throughout life with all of the tools that we have in diagnosis and in treatment. And that's all from me. Thank you so much.
Muchísimas gracias, Manuel.
Thank you so much, Manuel. I'm sure there are going to be questions. Was it a bit too much or was it okay? I have to go back to Seville now, and I'd like to be pleased with what I've done.
¿Una pregunta?
Any questions? No? Yes?
Bueno, primero que todo, muchas gracias.
First of all, thank you so much because the information that you've given has been excellent. But in terms of medication, in mental health and neuropediatricians never seem to agree. When our children's behavior is affected in neurodevelopment, there's so much difference between one diagnosis and another, or they fail to agree. I mean, what can I say? You've really touched on something there. I can tell you what I really think. There is a basis which is important, and I don't criticize this, but in psychiatry there's a series of schools and trends, including psychodynamics, behavioral psychiatry, where it seems that any neurodevelopmental disorder is unrelated to a biological basis. But if we ignore the biological basis, the only explanation is that it could be related to the surroundings, to the behavior. And that's where we blame the child or the family for his or her difficulties. I know it's not nice to say this, but a lot of families tell us that they're not listening to them, they're not accepting the child's clinical difficulties. And there's always a reason to justify the child's behavior that isn't just their own issues. And if that's the basis that we start from, then what can we do? It's going to depend on the training and the experience, and the biological basis is there, the disorders, the alterations are there, the treatments are there. So it's up to each doctor, each professional to do their homework. Thank you so much.